Since 2019, the use of GLP-1 weight loss drugs has spiked by over 600%. They have been positioned as the ultimate solution to the obesity crisis, reaching nearly 40 million people worldwide. Yet beneath the multi-billion-dollar marketing campaigns, a different reality is filling federal courtrooms. Patients are reporting life-altering gastrointestinal injuries and sudden vision loss that the glossy advertisements never fully explained. These emergency room visits and the rapid weight regain common among users are predictable outcomes. They are the direct results of how the drug forces the human body to operate. The process is best described as chemical thinning. The medication works by chemically overriding the body's natural metabolic and digestive pathways. Understanding the true cost of these injections requires looking past the number on the scale to see the specific systemic damage occurring to internal organs. The blueprint for these drugs was derived from the venom of the Gila monster. This reptile can survive for months without eating because its digestive system operates at an incredibly slow pace. GLP-1 medications mimic this venom by acting as a chemical brake on the human digestive tract. They hold food in the stomach longer to create an artificial sense of fullness. Pushed too far, this chemical braking leads to gastroparesis, or stomach paralysis. Digestive muscles stop moving entirely, leaving food trapped inside. This can cause food to rot, triggering violent vomiting and intestinal blockages. In severe cases, the system shuts down completely, known as ileus. The mechanism designed to manage appetite ends up disabling the body's natural digestive engine. Freezing the digestive tract creates a cascade of stress that extends far beyond the stomach to other vital organs. The pancreas can develop severe inflammation, or acute pancreatitis. Simultaneously, the change in digestion alters bile composition, frequently leading to gallstones and gallbladder disease. The kidneys also face significant strain. The persistent vomiting and diarrhea caused by the drug lead to severe dehydration, which can trigger acute kidney injury. These risks are reflected in the FDA black box warning, the government's most severe warning category, regarding the development of thyroid C-cell tumors. Users also face a massive increase in the risk of developing NAIN. This is an irreversible disease of the optic nerve that causes sudden and permanent blindness. All of these conditions are the predictable consequences of forcing a metabolic system to operate against its biological design. When the scale moves down during treatment, it is important to understand exactly what the body is losing. Up to 40% of the weight lost on GLP-1s is lean muscle rather than fat, a clinical condition known as sarcopenia. Because muscle drives your metabolism, losing it causes your resting metabolic rate to crater, burning significantly fewer calories. This leaves the patient physically frailer and metabolically weaker than they were before their first injection. The lower number on the scale masks a deeply compromised internal system that has lost its ability to burn fuel efficiently. Once the drug is discontinued and that venom-derived chemical brake is removed, the body attempts to compensate. The brain's hunger signals return with a ferocity that natural, lifestyle-based weight loss does not trigger. Clinical data shows that users regain an average of 22 pounds within a year of stopping the medication. This rebound occurs nearly 4 times faster than weight regain from natural dieting. Because the patient's resting metabolism was previously lowered by muscle loss, the returning weight is almost entirely fat. The patient ends up at their original weight, but with a higher body fat percentage and less muscle than when they started. This biological cycle transforms a weight loss tool into a lifetime pharmaceutical subscription, required to avoid an immediate rebound. True restoration requires addressing the root causes of metabolic disorder. Chemically freezing the digestive system is a biological debt that will inevitably come due.